The process of providing healthcare in an outpatient setting is a progression through a set of relatively universal stages that only vary slightly by discipline. Whether you're a pediatrician, cardiologist, physical therapist, or dentist, providing care progresses something like this. Gather the patient's information, evaluate them to determine what they need, get insurance authorization, finally give the care, and then bill for it. Medical offices all face the challenge of having multiple inputs, multiple sources of information, and variable timelines that have to be tracked and acted upon in a repeatable, auditable process. That process has to be understood by multiple types of users within the practice with varying levels of education and technological savvy. This solution is built to track patients through that care cycle. In its generic form, it will serve 85% of what any discipline needs. With only minor customization, it can be dialed in to be exactly what any medical office needs to manage their entire workflow. The example we're about to see was built for an office in the industry of orthotics and prosthetics, providing braces and artificial limbs to those in need. It uses the lexicon and necessary outputs of that discipline, but remember that small changes can make it apply to any specialty. So here is the main board, and from left to right, it is that care cycle as we discussed. We've got intake, and then there's scheduling, delivery, and billing are out further to the right. Each of these boards is a stage in the care process. You can manage this entire process from this board if you want to scroll endlessly to the right, or you can do it in the board and just progress down by department. So first and foremost, we need patients, right? So this is the patient's board. This is where all of their information lives. Generally, we want to have their information before they're seen in the office. So this is a form that could be sent out to the patient to have them fill out and submit. That would populate them as a line item in the main board, and it saves time and paperwork when they finally do arrive at the office. Likewise, we need to know what we're doing for that patient, and so we would have to have prescriptions. Prescriptions are often faxed over or emailed over by a doctor, so there can also be a form here where they could add the file and submit it directly into Monday. Once we have all their information, right, we have the patient's information and we have the information about what they need, then we can schedule them. So we're over into the scheduling phase on the main board. There is an appointments board for scheduling, right? So we see that Jane needs to be scheduled. So we could go to the calendar, filter by the office she wants to go to, filter by the practitioner she wants to see, and find a day and time for her appointment. Once she's been scheduled, she'll show up there. And then once the appointment is complete, she'll move down into this bottom section. Every appointment has to have a clinical note. So the note it lives in the line item of the appointment, right? Each of the appointments is tied back to a prescription, but every appointment has to have a unique note. So they can either use an external note writer, say they want to dictate through some external program that could be uploaded here, or they could write a note in Monday here using templates that they could populate. So here's one in a SOAP note or what's called a SUGAP note here, and it basically just helps write the note, ensuring that you don't forget any pertinent information. Okay, so the appointment's complete. We upload the note, any images they took, maybe any x-rays the patient has, and in this field, since the brace or the prosthesis is going to need to be built, a work order. That brings us back out to the main board. Now we've gone through that progression we talked about. We've got the intake, we've had the evaluation appointment. Now we need to get insurance to say okay, right? So we do the second insurance verification, get the authorization, and call for money. In this field, the way they tend to do it is, we can go to this billing board here. Basically, insurance will normally cover a portion and the patient will be responsible for a portion. So we collect the patient's portion before we begin fabrication, and then when they take the device home, we bill insurance for their portion. So this board will track based on L code and fee, how much they're going to owe, and bring us back out to the main board, where we come all the way over through here. Once money is all set, we get okay to fabricate, right? And that will generate an item in our fabrication board. Here we have just an overview. We can know kind of when it's expected to be finished. whether it's in progress or stuck, if parts are ordered, and about how far they've progressed through making the device. This way, if the patient or the doctor calls and says, hey, when is Robin Hood's brace going to be ready? We can say we expect it to be done on the 27th. It's about a third of the way done, right? But the people building the brace are going to need a lot more information than that. So in their board, we have, again, the patient, appointment, and prescription all populated in. We have when they received the order, the status, the due date, which is reflected on the main board, but then also the steps to build each brace, right? So as they progress through these steps, that progress tracker will also progress. When it's complete, we take a picture and write the date, and that comes back up to the main board. Now we're all the way over here. Let's go down to one that's complete. Okay. So Huckleberry Finn was completed. He's ready to deliver, right? So now we need to schedule a delivery appointment, that second appointment where we actually give them what they need. That goes through the same progression we went through with the calendar and appointments over here. Attach the clinical note. If he is taking the device, he signs the delivery receipt. Then we can send it to bill. We go back into the billing board to bill insurance for their portion. And once that's all done, we can close the chart, which sets it on a timer to be archived. As far as billing, we can do an invoice here, a one-off invoice if we want to generate one each time, or since no billing happens that isn't associated with a prescription in the item of the prescription, right? So here's Huckleberry Finn's device. We can go into his sub-items to see these are the components of what he got. These are the associated codes and cost, description, justification, all that sort of stuff for insurance. So we can come into his item, go to the quotes and invoices view, and have a quote already generated with his L codes, the quantity, the price, and what insurance would owe, or what the patient would owe. Okay, so invoicing can be done in two ways. The office will have inventory, sometimes off-the-shelf bracing, sometimes fabrication supplies. If you're not an orthotics and prosthetics office, you probably have something in your office that you have to track the amount of. That can be done here. There's the type, the manufacturer, part number for reordering, reorder level, and how many you have. And then also, this is handy at like tax time if you have to do inventory. This tells you the total value of everything in your inventory. We want to make sure that new patients keep getting referred to us. So we have a marketing board. Through this, we can track marketing campaigns, what platform they're on, that sort of stuff, just to help keep us finding new referral streams and staying strong with the referral sources that we have. Speaking of them, here is where we would track. These are the doctors that would send us patients, their NPI for billing purposes, contact information, and the practice where they work. So this is mirrored down to the practice board. Multiple doctors can work at the same practice, and a single doctor can work at multiple practices. So tracking them separately allows us to stay accurate with all of our documentation about exactly where this patient came from. Let's see, close that, close that. Lastly, these clinics employ people, right? Your providers are people who are employed by you. We can track who their manager is, how to get in touch with them, where they work, their email. We can also track things like their hire date in case you want to do something on their work anniversary, some kind of meaningful gesture. Also, in healthcare, frequently there are certifications that need to be maintained. So we'll have the renewal date here, and whether they need to renew soon or it's overdue, we can help keep all of our certifications active and make sure that no licensing, no certification, anything like that lapses and gets in the way of providing care. The last thing in this workflow is what we call metadata. This is data that doesn't change much. So this is a list of our manufacturers that's listed in the inventory board. These are central fabricators where devices might be sent to be made. There are some things specific in healthcare that are procedure codes. So for orthotics and prosthetics, they are L codes. There are also E codes, A codes, that sort of thing. Whatever your practice needs, basically it's always available from the government in a CSV, so we can upload that form into here and you will have all of your procedure codes for use with billing. Same with ICD-10 codes. These are the diagnosis codes that come from the government. They're the basis of healthcare and healthcare billing. So again, this full set of ICD-10 codes would just be uploaded into the metadata here for reference. Also things like your facilities. If you have multiple offices, where are they? How do you get to them? What's their phone number? All that information lives down in here. So that's the end of the care cycle. But say you're a manager and you have 5 offices, you can't go down into each board to know what's going on. You want a higher level view. So with this dashboard, we've got a few widgets in. There can always be more clarity added, but this lets you know how much billing is in progress, how many jobs there are in fabrication, how much billing has happened year to date. If you want to double check that your work is evenly distributed across your practitioners, you can have an active patient count by practitioner. If someone's overloaded, sometimes it's hard to get in to see them. So by keeping this count even, you can ensure that patients are being seen as quickly as possible. You can see across your clinic how many patients are in which stage of care, and a breakdown of orthotic and prosthetic by discipline. If you're curious for your marketing or with your referral sources, you can see by doctor and by discipline how many referrals they've sent you. That can help with clarity of what's going on with your marketing and with your referral base. And then here is a map widget. You can put in the location of all your offices and say a patient calls and wants to know which of your offices is closest to them, right? So their address, based on that, you can see which office. Or say a hospital calls and needs you to come see someone there, you can quickly identify which of your offices is closest to that hospital. Lastly, wellness calls. We never want to go more than 6 months usually without keeping track of our patients. So touching base, making sure that they have everything they need. This, we'll go over it in just a minute. This kind of highlights by practitioner who has outstanding calls and overdue calls. So wellness calls are done by patient. So that lives over in the patient board. Basically, each appointment is stored as a sub-item and its date is stored here. Let's delete this one and pretend we did not get in touch with Robinson Crusoe. Okay, so this thinks that the last time I saw Robinson Crusoe was June 27th, 2022, right? Based on his sub-items. So he would obviously need a call. There's an automation that's always listening to these dates. If it gets to 2 weeks before 6 months, it will change it to needs call, set the due date for that call to be February 5th. And it should send me a notification that he has a call due. Let's see here. If it switches to overdue, meaning that date has passed, I now get a second notification here that says he needs a wellness call. Oh, this is the first one. Needs a wellness call by. There we go. And there's the second one. His call was due on the 5th. Please call him as soon as you can, right? So there is the needs a call and the overdue wellness call. And then based on these here, that's what's reflected up in the dashboard. All right. And then, of course, there is a guide to this whole workflow here based on section. If you need any clarification about how to use it, that's all in there. So that's the end of this overview for this case. Remember that even though this example was for an orthotics and prosthetics office, this workflow is very adaptable and can be easily customized for other medical specialties. I really hope you use this solution to streamline your internal process. It'll let you spend less time on the computer and more time with your patients. Thanks for watching.